Hey everyone, welcome back to the Carpal Tunnel program. So this is actually video number 2 in the 4-part series. I hope that video 2 was useful and you found some really good information in there to help you. But it wouldn't be complete without the other videos, so I do encourage you to watch them all. And if you're just joining us now for the first time, please do go back and watch video number 1, as it really will help explain a lot. But just to recap, of course, the Carpal Tunnel program, designed by Fresh Reality, is simply here to really help people with this problem, and that is not just tackle the symptoms but tackle the problem. Now, really quick introduction of who I am. My name is James O'Donovan and I'm a trainee doctor based in Nottingham, England. Now, I started Fresh Reality with a simple purpose and design, and that was to bring world-class information to people with health problems so that they didn't have to rifle through the internet through hordes of really bad information. And so I simply don't pretend to be an expert on carpal tunnel, at least I certainly wasn't. But I would hope that through the copious amounts of research I've done and the people I've managed to connect with, that I've brought together some incredible information condensed into an easy program that really should help people, and I really do hope it does. So, during this video, what we're going to do is talk a bit more specifically about what causes carpal tunnel syndrome, the really common overlooked problem in medicine. And I'm going to tell you some really great tips, modifications that you can do in your life that will help relieve the pain and the inflammation, and some exercises that you can do to actually help combat carpal tunnel. All right. So, while I really do hope this program will help as many people as possible, and I know it can, unfortunately, it won't necessarily be as effective for some people with certain conditions. And so those with neurodegenerative disease, and possibly those with diabetes, although not all diabetics, but also people with severe circulation problems. Okay. Nonetheless, this program may indeed allow you some relief. So I would still encourage it, but unfortunately, it may not completely reverse the problem as it would in some other people. Anyway, so back to the classroom for a minute, if you could just humor me. So what we've got here is a diagram, a cross-section of the wrist area, and the reason I wanted to show you is because just understanding the anatomy will really help you appreciate why certain movements are causing certain pains. Now you can see here, this is the median nerve, this yellow cable that runs through the wrist, housed by this carpal ligament, and you can see just by this area here, it's a tight squeeze in there, and so there only needs to be a small amount of inflammation or a change in the structure to cause some problems. So the point that I really want to get across is that whilst in some settings carpal tunnel is looked at as this chronic and uncurable condition, in most cases it is so completely reversible. Now, unfortunately, women are actually 3 times more likely to suffer from carpal tunnel syndrome. Sorry ladies, unfortunately that's the way it is. It could just be because of a slightly smaller carpal area is found within women, but again, doesn't mean it's not reversible. It is. So the reason that it's reversible, and this is the crux of this program, is that it is to do with the muscles. Now, muscles can easily be manipulated and changed, and is the way they adapt, but it can also be a downfall, and it is the muscles in the forearm. So I know that picture looks a little bit daunting, but there are over 14 muscles in your forearm and arm that allow, the incredible array of movements and flexibility and range of motions that you have. And whilst that is amazing, if you overindulge certain ones, it causes an imbalance. It's kind of, it's common sense. If you were to just work one muscle in the gym, it would get much bigger and stronger than the others, and it can cause you problems. Now, this is where most of the problems come from, for most people, where the problem comes from. Okay, and it's not something just exclusive to your wrist. We see this a lot in other conditions. For example, people who have lower back pain so often have tight hip flexors compared to their gluteal muscles. Also, the balance between the pectoralis, that are your chest muscles, and your back muscles. So often people naturally, and also in the gym, they work on their chest muscles more than they do the back, and the result is you get rounded shoulders. You see that a lot, and of course that has the problem of bringing your shoulders too far forward, causing a strain in your neck, and often the headaches and the neck pain stems from that. And so your wrist has to be treated with the same amount of respect and diligence when it comes to that, and appreciation of the balance of muscles. So as we've talked about in the last video, over half of all carpal tunnel syndrome comes from occupational related, well, just occupations, but occupation related movements. and activities. And that's because if you're doing a job for 6, 7, 8, 10, 12 hours a day and you're doing very repetitive movements, it's no surprise that certain muscles will become larger, more toned, and create an imbalance. So this is where the problem comes from, and it happens for a couple of reasons. So, like I said, thinking about your day-to-day, what movements do you do more than others? Are you a typist? Are you flexing those the digits so much? Or are you someone who's doing a lot of packing? Are you someone that uses a plier and a grip tool? You know, these are things that you have to think about. And you probably know yourself, because as well as your carpal tunnel, you may have noticed certain knots and tightness and soreness in the forearms. I know being left-handed, I think just when I was growing up and learning how to write, I had to adapt so not to smudge the ink. So I would crook my hand, and I have an awful writing style, which is perfectly in line with being a doctor. But yeah, it's terrible. And from that, because I crook my hand and I bend it in so much, that I get really, really tight forearms. So I've had to combat that and try and adjust my writing style. But like I said, what we do is we create this imbalance when we indulge some activities more than others. Now, normally for most people, this is the closing motion of your hand. So that is using the flexor muscles. These are what are found on the underside of your forearm. And as I said, these are what are responsible for closing your hand. So you think about all the motions in your day that involve you closing your fist or picking up items. That is the work of largely your forearm muscles. And when you compare that to the ones that actually open your hands, you do these much less often. And in studies, they found that the flexors are generally much stronger. Now, what this causes is it can change the natural position of your hand. Naturally, your wrist might be slightly flexed or slightly extended depending on the muscle imbalance that you have. And it's very much like Farland's maneuver that I spoke about during the first video, where we intentionally impinge it by flexing the wrist or extending it. But if you imagine if you are naturally like that for most of, if not all, the day, then it's no surprise that your nerves will become irritated. And it is like a hose pipe with a kink in it. No water can get through. So it can also, the effect is actually change the structure of the carpal tunnel. So the carpal tunnel bones forming that arch actually have small joints in between them that allow a small amount of movement. And when you put a lot of pressure on that arch through the muscles, you can actually change the structural integrity of that area, at least temporarily, and causing the cavity, the area, to reduce in size, and therefore putting pressure, compressing the median nerve. So, as I said, thinking about the day-to-day activities that cause it, there are an awful lot, like typing, picking up objects, any squeezing motion, any weightlifting if you're a gym fanatic, and of course racket sports, working with tools. We do it a lot. You think how many times a day you're holding on to things and grabbing. It's quite natural. But if you're also, your job involves you doing an awful lot of it, then it's unsurprising how it can lead to certain difficulties. So what does this mean, having an imbalance and an overuse? Well, it causes carpal tunnel in a couple of ways. It can cause two things. The first is what's called microtrauma. So there's been certain experts who have discovered that when you repetitively use a muscle, especially in times of bad form, then it causes the fibers that normally glide over each other very nicely to tie up. They get into knots. Most people are familiar with this. You get tight back and shoulders and things, and you can actually at times feel the knots. Well, this happens on a very small scale as well. Tiny little bundles of fibers, and these have been coined myofascial trigger points or spasms. Now, what can also happen are micro tears, and these are just small little tears in the muscle. Now, the problem with here is that scar tissue can form. Now, scar tissue is very different to the consistency of normal muscle fibers, and it's an adaptation. Your scar tissue, it's there to try and stop further ripping. It's quite rigid, but it doesn't have the functional capability that muscles do. It doesn't stretch in the same way. And so what often happens is your muscles can become shorter. Now, the trigger points also cause swelling and inflammation just as the same way that scar tissue can form and is damaged is your body's natural response to cause inflammation. The second thing is the actual irritation of the tendons. Now, the tendons are the cables and the machinery of the hand, and usually they slide effortlessly in their sheaths. And this is assisted by lubrication, a synovial fluid that helps them move up and down very easily. The problem is, if you're doing certain repetitive movements, especially under force or strain, you're doing it an awful lot, then you really put to test your body's capability to be able to produce enough synovial fluid. And when there's depletion, there of course is more friction, and this causes even further inflammation, which is why it's so important to rest. You've got to rest to give yourself the chance to replenish. So that causes even more inflammation. So together, considering bad form, the trigger points, the tears, the drying out the synovial fluid, the overall result is an inflamed hand. Now, this is overlooked in mainstream medicine, as this is David Simon so delicately puts it here. Muscle is an orphan organ. No medical speciality claims it. As a consequence, no medical speciality is concerned with promoting funded research into muscular causes of pain, and medical students and physical therapists rarely receive adequate primary training in how to recognize and treat myofascial trigger points. And it is true, I can speak firsthand, whilst education in medical school is phenomenal, it's hard to cover everything, and unfortunately this is something that is at times overlooked. So, there are certain occupations that lend themselves so much more to carpal tunnel syndrome, things like factory workers, gardeners, typists. But doesn't mean the end of your career, doesn't mean the end of your health of your hand, not at all. You just have to be aware, and you can make certain modifications, and you can combat it using certain exercises. So that's what this is all about. So here's the good stuff. So firstly, avoid activities requiring excessive up and down when you can. Now, obviously, if your work does involve it, it's understandable, but try and focus on the form of your hand. Try not to make sure it's kinked, it's on a level play, and I've got some diagrams to show you in a minute. So these are the repetitive motions most likely to cause CTS. So keep your hands properly while working. They should always be parallel, and elbows should be at a 90-degree angle to your work surface. And to that effect, avoid putting direct pressure on the heel of your hand. And so anything where you're really leaning to one side or having to brace yourself, or again, if you're at the computer, even if the heels of your hands are constantly having weight on them, it's a very unstable area, and it can put pressure on the exact area where the median nerve is. And so it's very unsurprising should you get irritation of it. So if you are a keyboard warrior, then here's the proper form. Now, you may be well accustomed to this and it might not apply, and that's fair enough, but even if you're not someone who works at a computer, then I would definitely still take a look at this, because you can apply it to most settings, and it will just give you the idea of how your hand should look in certain motions. The idea is to avoid these kinking. You see here the amount of space there that the median nerve has to travel in, like a hose pipe going around a corner. It will get kinks in it. So try and keep a nice level playing field. And the same here, going in the abduction and adduction of the wrist. Try and keep it nice and straight. Alright, so working with white knuckles. So it is our tendency, or at least some people, to grip hard with whatever they're doing. Now, I remember when I was learning to drive, my driving instructor gave me a piece of advice which I thought was actually very, very good and helped me, especially at times when you're nervous and your tendency is to grip. And he said, simply put your thumbs on top of the steering wheel. And that did help, because you're not using a full fist, and that just helped me relax. And so I would definitely tender the same advice, because whatever you do, just try and relax your muscles. You won't be helping them perform better by gripping harder, and you're only going to increase the chances of them tying up into knots. So it does play a huge role, stress and tension, in the irritation of the muscle. So big one, take regular breaks. I know I've said it before, but it is so important, because you need to give your muscles a break. You need to be able to give you a chance to oxygen and nutrients to get to your muscles, get lactic acid out of your muscles, and just to make sure that the synovial fluid can replenish. So I'd say at least every hour, take 5 minutes. Now, I would encourage more than that, but I know some people will have bosses breathing down their neck, and it can be difficult. So I appreciate that, but important point is, when you can, just even if it's not getting up from your desk or whatever you're doing, just shake it out. Try and do some stretches, which I'll show you in a minute, and really just take a moment. Okay, try and stretch the upper extremities and get the blood pumping a little bit. Yeah, put your joints through their normal motions. And what I mean is this: every joint has a natural motion. Your wrist, for example, is known as a gliding gliding joint, synovial joint. So it's allowed 4 motions, and that is the flexion and the extension, slightly up and down, and a small amount of side to side. So put them through these motions. Yeah, because often you'll just be doing one or a couple, but it's important to exercise the joint in its full capacity. Right, so what exercises can you do? I know you've been waiting long for the actual nitty gritty, the important stuff here, so I'm sorry to keep you waiting, but thank you for bearing with me. So when the muscles are the problem, we work on the muscles. It's that simple. Nothing about this imbalance, unless brought about by major trauma, is irreversible. If it's brought about by your occupation and a long time of just bad form and repetitive motion, then you can definitely combat this. You can help prevent it, you can make modifications, and you can combat it with even better exercises. So there was a study that showed that, in fact, effective use of manipulation and load bearing, like using stretches and the right exercises, actually create a relief of pressure on the median nerve in patients with carpal tunnel syndrome, and it reduced the need for surgery. So one thing I would tell you before I show the exercises is often it's people's thinking, and often on bad advice, is when they have these problems in their hands, they assume that it is a weakness, and in part there is an element of truth to that, but often their first port of call is to go and get hand grips and do hand grip exercises. Now, if your problem is that you've been doing flexion exercises too much and that the imbalance is because of that, then this is only going to make it worse. So I beg you, just think carefully about what you're doing and where your imbalance may be, and if it is in the flexor muscles, please do not do this. Okay, I had a nice little quote there by Joshua Tucker, who's an expert on tendonitis and other related conditions, and he says, when you have tried all the usual options and they have failed, it's still not too late to become pain-free, and it's also never too early to start. And very true words. So the idea about the fresh reality approach is quite simple. We're going to address that muscle imbalance, and that for most people will involve strengthening the extensor muscles that open your hand and lengthening the flexor muscles that close your hand. Pretty simple, right? We're also going to improve overall dexterity in the fingers and the hands and reduce pain and inflammation. Now, of course, the first 2 points apply to people who do have an imbalance in the flexor muscles, but if you know for yourself that it's in fact doing the opening hand more, then you just simply reverse that. So here's one of many stretches. The first, the prayer stretch. There's a nice picture showing you how to do it, and you just start with your palms together, very much like the reverse Farland's maneuver, and slowly lower your hands towards your waistline. And you want to try and keep your hands close to your stomach and your palms together until you feel a nice moderate stretch under your forearms. And try and hold that between 50 and 30 seconds. You might find it a bit difficult to begin with, and that's absolutely fine. You'll get better as time goes on. And repeat that maybe 2 to 4 times. The next is a wrist flexor stretch. This is one of my personal favorites. I love this. Again, I said I have problems with my forearms because I'm writing, and so very often in the classroom I'm doing this because it really does help, and it gives you some relief. So what you need to do is extend your arm in front with your palm facing up, and with your other hand just gently grab the fingers and trying to keep them straight, just pull back towards yourself, and again hold this for 15 to 30 seconds and repeat 2 to 4 times. And then switch, of course. Now you can, as an alternative to this, you can use the wall. So you simply put your palm against the wall, and then you just simply use that and to create the stretch that you desire. Now here we go. Here's a wrist extensor stretch. And again, I'll leave it up to you to know what is good and what needs stretching. But there's no harm in stretching all your muscles. You just have to be careful to make sure to appropriately exercise the ones that need it most. So here we're just doing the reverse, where you put your fist out and then with your other hand put it gently in towards you, and make sure that you put your hands more on the base as it's shown in the picture rather than just on the ends of your knuckles. You actually want it around the back side of your hand, and again hold that for 15 to 30 seconds and repeat 2 to 4 times. Simple. So a common question I get, and a lot of people are asking, it's a very fair question, is should I be taking drugs? Should I be taking non-steroidal anti-inflammatories? And that is just the scientific word for your basic anti-inflammatories and pain relief. Ibuprofen, paracetamol, codeine. Now, I can't tell you any way or the other. If these pills are bringing you some relief, then that's fantastic. The only thing I will say is that these do nothing to actually fix the problem. They can provide you temporary relief, but temporary being the key word. They will simply tackle the symptoms, they will mask the problem, but they will do nothing to fix it. And the tendency is there is we will take these pills for as long as we need them, which will be forever unless the problem is tackled. And you'll be forever on a cycle of medications, all of which have side effects and are damaging to your body in other ways. So I'm not going to say don't take these things, because when pain is a lot, well, of course, sometimes you need relief, and that's fine. No one's judging you. But all I would say is really think about yourself and what you want to do here. Do you want to just tackle symptoms, or do you want to tackle the problem? So I know we covered a fair amount in that video. I gave you some stretches there, but we're going to be doing loads more. So thank you ever so much for staying with us for video 2. Video 3, we're going to do more exercises, even some of the best tips and best ways to reduce the pain and inflammation. And don't worry, no more trips back to the biology classroom. We're also going to be talking about another frequently asked question about wrist splints. And of course, the best foods to avoid and the best ones to eat is simple. So anyway, thank you very much. Please leave any comments or ask questions below. Stay healthy, stay positive. Thank you very much, guys.